Good morning. Welcome to the Winter 2024 webinar of the National Pharmaceutical Congress. I'm Mitch Shannon of Chronicle Companies in Toronto. We're here today to ask the question, could a US FDA ruling mean Canada's drug supplies might be diverted south? Just asking that question introduces many anxieties and follow-up questions, and we're about to get some insights this morning from a knowledgeable faculty. This issue of reimportation, as some call it, is just one of the emerging challenges and who knows, maybe opportunities facing the health system and potentially disrupting our work in the life sciences. There are other critical matters that we may need to stay ahead of in 2024, so continuing our role of the past 18 years in encouraging these discussions, the National Pharma Congress has extended its mission this year. Leading up to today's webinar, NPC surveyed pharma executives, carried out stakeholder interviews, analyzed and created a white paper on this topic. You can download the white paper during this session if you haven't reviewed it already. Just go to tiny.cc/NPC24A. These research activities and policy recommendations are done through the NPC Institute. The name is a bit grandiose, but the purpose is totally down to earth. We just want to know the following. Where are we as an industry on these issues? How did we get here? Where are we going? So let's deal with the second question first. How did we get here? To get up to speed on the background and context of this issue, we've prepared a 2-minute explainer video. Please watch.
In 1867, Canada as an entity was created at least partially in response to disunity and violence south of the border, notably the U.S. Civil War, the Fenian Raids of 1866, and U.S. territorial ambitions, something called Manifest Destiny. Confederation formalized and facilitated a system of east-west trade routes, Ontario and Quebec to Atlantic, and discouraged north-south trade through import tariffs. The modern phase begins in the year 1947, a time when the world was recovering from World War II, and countries, including Canada, were seeking to improve their social welfare systems. Inspired by the creation of the National Health Service in the United Kingdom, the provinces of Canada embarked on an ambitious journey to advance public health care. Over the next 37 years, this journey was marked by several milestones, each contributing to establishing a comprehensive public health care system. These efforts culminated with the Canada Health Act of 1984, a landmark legislation that promised all Canadians universal health care access. Notably absent from this act was pharmacare, leaving a gaping hole in the healthcare safety net. Previously, 1949, another pivotal event took place on the international stage. The North Atlantic Treaty Organization, or NATO, was formed. This redefined international relations, formalizing North-South defense alliances. In 1962, Canada's currency was officially devalued under the Conservative government of John Diefenbaker. The Canadian dollar plummeted from parity with the US dollar to a mere 92.5 cents. However, it had a disruptive and lasting impact on the Canadian economy. In 1993, the Clinton administration's proposal to introduce US universal health coverage following the Canadian model failed to become legislation. The following year, the NAFTA treaty was enacted, increasing the flow of goods and services from Canada to and from the USA. The treaty is now known as the USMC Trade Agreement. By 1998, advances in the Internet and World Wide Web led to the creation of Canadian export pharmacies, created to send discounted prescription drugs to U.S. patients, taking advantage of a Canadian dollar then worth 63 U.S. cents. In 2005, the annual total value of sales to the United States through the 278 Canada-based Internet pharmacies was estimated at $840 million, with another $500 million exported via so-called foot traffic from brick-and-mortar drugstores. This year, 2024, sees profound uncertainties arising from new U.S. domestic circumstances. The FDA's decision to allow the state of Florida to purchase its formulary drugs in Canada only reintroduces and exacerbates tensions that have existed for a mere 157 years.
And special thanks to Joe Knott for teaching us the proper pronunciation of Diefenbaker. Before we bring out our panel, let's just take a minute to thank our supporters for today's program. Bayshore Specialty RX, Impress, McKesson Canada, RX Help One, Talk Communications, Torrey's LLP, Chronicle Companies, and the Pangea Group. They are, as always, the finest companies in healthcare. Now we'll hand things over to our friend Ben Parry, who's going to moderate today's fascinating discussion.
Thanks, Mitch. Good to be back, and happy to be moderating today's conversation. So it's always a pleasure to get online here and talk about key topics that are shaping and impacting our industry. So today we're going to get you warmed up with a couple of poll questions before we get into introducing our opening overview and our panelists for some opening remarks. So maybe if we can pull up the first poll question, let's see what we have on tap for today. So how concerned are you about the affordability of medications in your markets? Not at all concerned, slightly concerned, very concerned, but unsure what can be done, very concerned and have taken action, concerned, but nothing can be done. Love to get the audience's opinion on this to get us warmed up and get started. So give it a moment and please give us your thoughts. Okay. But we take a look at some of our responses. All right, interesting. Quite a majority there. So very concerned, but unsure what can be done. So hopefully today's session will help inform some of the concepts of and parameters of what we're actually dealing with in the topic today. Let's pull up our second poll question to see what we have in warming the audience up as well. So should U.S. institutional buyers be able to enter purchasing contracts with medication suppliers outside of their nation of operation? So yes, they should. No, they should not. It depends on the medication, or it depends on the nation. So let us know your thoughts there. It's going to be an interesting dialogue today. We've got some great speakers to round out the topic. All right, let's have the results there. Okay, interesting split. So no, they should not, or it depends on the medication. So there's some interesting feedback there with some other votes on the other side of the top and bottom there. So interesting. So thanks for that, because it's important to understand where people's perspectives lie so that we give you the right content as we go forward with these webinars. So with that done, what we're going to do is I'm going to introduce Dr. David Kreling, Professor of Pharmacy at University of Wisconsin, and he's going to provide us an opening overview just to warm up and get the topic underway for us today. But before we do that, just want to give you a little bit of background on David. So David's practiced as a pharmacist in independent chain and institutional pharmacies before completing his PhD. And his primary activities or primary academic and research interests are in what often is referred to as traditional pharmacy administration, marketing, and economics. Much of his research has been in the area of pharmacy economics and policy, primarily finance and reimbursement issues in community pharmacy. So great to have Dr. Kreling join us today, and I'll turn it over to Dr. Kreling for opening comments and an overview. Thank you.
What was your initial reaction as a former pharmacist and professor of pharmacy to the news that the FDA would allow Florida to import medication from Canada to lower costs in the US?
Well, I first thought was, well, this is not new because it's happened before. There's been noise about this, and so this is kind of a reiteration. It hasn't been successful in the past, so I said to myself, this probably isn't going to go anywhere this time either.
What stopped US buyers from bulk importing drugs from Canada in the past?
A part of it was there was a response from the industry was, well, listen, we can put quotas on our supply chain. We know that we've sent X to Canada before. Why should we send X plus now? Because that's going to be moving back to another market. And so, rightfully so, they had propriety, if you will, to say, well, wait a minute, we're not going to send you any extra medications, so you can send them someplace else. That's just not part of the game. So that hasn't done that before, and I think that's going to resonate again this time, and it's one of the issues. I mean, we have to play nice in the sandbox, and if we're going to take all the other kids' toys, they're not going to let us play in the sandbox.
When can we expect Florida to begin their bulk importation of Canadian medication? Is there anything pharmaceutical and healthcare professionals should prepare for?
Like I say, I'm not really sure this will have legs. I'm not sure it will necessarily go what they think it's going to happen. Again, the devil's in the details, and I don't know that those details are going to work out. There's all kinds of things that are involved with this. When you introduce this kind of a phenomenon, recognize that in the U.S., it's unrare. It's rare for people to not have coverage. That's so almost universal, and so as a consequence, the whole sort of supply and the pricing and the payment goes through coverage plans, and they are based upon the sort of standard sort of, if you will, list sort of channel ex-factory pricing that the manufacturers set for their products in the U.S., and then that transfers through. So that affects the consumers and their cost sharing, and it relates to how much they have to pay. It relates to what the pharmacists get paid for the drugs when they dispense them to those customers. And then in the US, because of this whole coverage phenomenon, there's this aftermarket phenomenon that occurs with aftermarket adjustments and rebates, which are contractually connected with product placement and volume, where then there's a agreement between the manufacturer and the pharmacy benefit manager or the plans, and then the plan sponsors for rebates after market to adjust the price after the fact. So when you introduce a different sort of cost at the starting point for the pharmacies, it's going to create all kinds of phenomenal changes with, well, do we have to set a different price to the pharmacies for those? And when that happens, and if that doesn't happen 100% of the times for a given product, how will they know when and where to make that adjustment? Same on the consumer side. And then there's a lot of details, and the devil's in the details for how this is potentially going to work out, and liable to generate all kinds of craziness that goes on with those manipulations and those machinations that are outside of the sort of standard and normal channel chain of custody and pricing phenomena that happens in the US. I don't know that there's really going to be a real start off on this. So I'm not sure that, other than professionals in the US getting questions from consumers in Florida say, well, when are we going to get cheaper drugs from Canada? And the pharmacist is going to say, well, don't hold your breath, perhaps. And the same is true in Canada. When are we going to start losing our medications to go to the US? And say, well, again, don't hold your breath, because there are some other facets that come to play that are going to really make this logistically challenging to occur. Not to mention the, like I say, good relationships between, the countries and their healthcare professionals in both countries.
And what would you say to Canadian pharma and healthcare professionals who were concerned about the FDA's decision?
Actually, kind of in my prior comment, the prior question, I would say be patient. Obviously, express your concerns. I think they're valid and they're legitimate. They were in the past and they have worked in the past. But also, maybe don't get in too much of a tizzy about it, because it's liable to potentially kind of go away on its own. There's so many sort of moving parts, and some of the difficulties with this attempt in practicality that are probably going to be dominant with having this not really get legs like it might be expected, and the nice rhetoric, the good feeling that people have, well, we're going to get lower cost drugs. Well, maybe not. We already enjoy that here in the US, and for those that do have very expensive medications, except for when they're either in the deductible period, if they have that with their plans, or if they are not covered, or the medications are not covered, that's still going to be an issue. But sometimes those are also drugs that don't have great value propositions, that and that relates to how things happen in some other countries where they do a value proposition assessment, and that influences the price that they're willing to pay as the government. So long and short, Canadian pharma and healthcare professionals, hang tight. I'll be quite surprised if this really takes off and has legs and has a major impact, to be honest.
Wonderful. Thanks for those comments, David. That's wonderful to have you on this session today. So what we're going to do is we're going to introduce our panelists for today now as well. we're going to go in order. So we're going to start off. I'm going to introduce the panel, and then each of them will come on and each provide opening remarks for today's topic. So first, we're going to have David Renwick, Interim President of Innovative Medicines Canada. David's also a longtime industry veteran as well, and I'm looking forward to seeing what insights he has today from us from the IMC perspective. Second, we're going to have Danielle Peters. She's the president of Magnet Strategy Group and has been a strong voice and advisor on policy, both in Canada and the US on numerous fronts. So happy to have Danny joining us today. Third, we're going to have Jaclyn Katelnikoff, strong voice and community leader from a clinical pharmacist perspective, coming from Saskatoon, representing Saskatoon Family Pharmacy out in our prairies in Canada. So happy to have that voice online here today as well. And last but not least, we've got Ted Witek, who is professor and senior fellow of the Institute of Health Policy, Management and Evaluation at the University of Toronto. So thank you all for joining us today. We're going to have the opening remarks, and then we'll get into the open panel discussion a little bit on the back end. So David Renwick, I'll ask you to join us for your first opening remarks, and then we'll move on to Danny, Jaclyn, and last but not least, Ted.
Excellent. Good morning, everyone, and thank you, Mitch and Ben, for bringing us all together on what I think is a very, very important topic for all of us. And I guess I'll start with, I look at the bulk importation issue through a couple of different lenses. One, obviously, as interim president of Innovative Medicines Canada, representing the 50 plus organizations and manufacturers here in Canada. But in addition to that, my experience and past in the industry, leading different organizations where we've bumped up against issues like bulk importation in the past. So I'll start with, from an innovative pharmaceutical industry perspective, we're very concerned about this potential risk of bulk importation and the effects that it could have on the Canadian drug supply. And I think the consequence of a negative effect on the drug supply would obviously be a negative impact on Canadian patients. So when I'm looking at this issue, I think it's really important to consider at least three things. The first is the global supply chain. And what this means for global manufacturers is that they have a very good idea generally of what their patient demand is going to be in each market. And they typically will produce to those demands and the expected growths and so forth. And that's what gets exported into different markets, and that includes Canada. I think when you consider things like expiry dates and different labeling requirements, shipping, et cetera, one can imagine that the costs associated with all of this can add a level of complexity and burden. Manufacturers exports to Canada with a great deal, they do apply a great deal of precision, and a lot of sophisticated thinking goes into providing this. So as a consequence of all of this, it's really difficult to accommodate for major shifts in these things, such as what would be the case with bulk importation. And I think that's what is one of the contributing factors that I think we should consider. Secondly, Canada and U.S. obviously have vastly different market sizes. Florida alone has 23 million people, and the potential for 17 other states to introduce laws that would facilitate bulk importation makes this very concerning for all of us, just simply on a scale basis. So, bulk importation, when you describe it that way, it becomes a really bad idea, a bad policy for Canadians, and it won't have very favorable outcomes for Canadians. But I would add that because of that scale difference, our ability to provide anything meaningful in the way of supply to the U.S. Would really not realize any really significant advantages. Drug shortages, on the other hand, would cause a whole bunch of problems for our healthcare providers, and maybe force them in extreme scenarios to force them away from turning away patients and having to switch to alternative medicines against maybe their better choices or to costlier alternatives. So Canadian patients don't don't have access to their prescription drugs that they rely on, they arguably could become sicker more quickly, and it puts just an undue burden and additional problems, challenges on the healthcare system, and that's just not a risk that we're able to take at this juncture. I think the third consideration has to be is that we do have mechanisms in place to reduce product diversion, and I think, as has been noted by some of the other speakers, some of these things have been in play for a while. But Health Canada now has regulations in place that ban the exports of drugs from the Canadian market that could cause or worsen any shortage. That's the first thing. So when the news that the FDA was going to allow Florida's plan to import from Canada was brought to light, I was pleased to see that Health Canada re-upped and reassured Canadians that the government was taking the necessary steps to safeguard the supply, to make sure that all Canadians have access to the prescription drugs they need. Minister Holland, the health minister, also spoke with the U.S. stakeholders, Secretary of Health and Human Services, as well as the U.S. Ambassador to Canada in the days following that announcement, to really express our concerns on behalf of Canadians. This is a really encouraging signal that the government's is taking this as seriously as a lot of us other concerned parties would as well. So it'll be just as critical to ensure that the regulations that we have are adequately enforced, and lines of communications with the U.S. Continue to stay open, which has been the case thus far. So I'll sum up there, and I'll just say that really bulk importation is an issue that we absolutely need to take seriously, and I'll say that we are taking seriously. And while there might not be any need for immediate panic, as been alluded to already, Canada is taking the necessary actions to prevent the exportation of drugs that could result in shortages for Canadians. Thanks very much.
Wonderful. Thanks so much, David. Danny, we'll invite you to the stage. Thanks for coming today.
Great. Thanks so much, Ben. Thanks much for having me. So my name's Amy Peters, as I said, and I'm a senior advisor to the Alliance for Safe Online Pharmacies in Canada. And ASOP is a global nonprofit organization committed to keeping the public safe from rogue online sellers of prescription medications. And so our interest in this issue really goes to just what David said too about drug shortages. We know that Canada does not have the supply of medications required to meet the needs of population 10 times our size. And so we have been very much out in front and advocating for the interests of Canadians in response to U.S. importation plans for medications. When we look at this issue, now that the FDA has approved Florida's application, we have to analyze what the real risks to Canadians are. So as David said, Health Canada has put regulations in place to prevent the bulk exportation of medications that could contribute to a shortage in Canada, or exacerbate a shortage in Canada. And so we have to then look at the regulation that's in place and identify still any underlying risks. And when we look at that, we one of the risks we see is that with what happens is that each state, let's say in the state of Florida, will have to publish a list of the medications that they are filing with the FDA for approval on a per shipment basis. And so we see in Florida's latest round of the application they submitted to Florida, they have a list of medications, and it happens to be that there's a high portion of HIV medications that are on that list. And so we have to then, it gives us a lens to understand, okay, we understand the patients in Canada that rely on these medications, and what are the mechanisms we have in place, both with the regulation that prevents bulk exportation, as well as other tools that we have to prevent drug shortages with these medicines that we rely upon. We have to understand all the tools in place to prevent that. We know, as our opening speaker said, that is this really going to go forward? Because we know that manufacturers have agreements in place, and so even though there is an approved foreign seller under this program, is there going to be some interaction that happens between the manufacturer in that to ensure that these medications are not exported to Canada? But even still, we have to understand still, to ensure that we're protecting those medications for Canadian populations, do we have all the tools in place to prevent it? One risk that we see is that if patients in Canada see the list, which it is public what the states submit. So in Florida submit that list, patients might see that and say, well, wait a minute, is Florida taking my drugs? This is what our role is too, is to explain what Canada has done to prevent sort of a run on the pharmacies that might occur. For example, yesterday, Colorado resubmitted their application to the FDA. They submitted a new list of medications, some of which we see very much in the news in terms of high demand in Canadians and shortages in Canada. So we have to ensure that we have a role to play in educating Canadians and Canadian patients that there are tools in place, but to make sure that the regulations we do have in place, just in case, prevent that. One other thing I want to say is that we have to understand that this is very political. So even though we say this isn't going to happen, we have tools in place, it's very political, and it happens to be that the idea of selling medications, Canadian medications to Americans is very popular, which is why politicians like to talk about it. And it's very complicated to talk about Medicare Part D and negotiating drug prices and things like that. It's much easier to say, I'm going to get my drugs from Canada. So when a population expects it, we have to know that the temptation to even lean into that further and to maybe if the current FDA final rule isn't working to bring medications to Canada, what can they do? And this is what at ASOP we are concerned about, is that there are currently US states that have contracts with what we call internet brokers that facilitate the sale of medications from Canadian pharmacies and international pharmacies. And the temptation might be there for states to officially use this as a channel. And there are some oversight gaps in Canada that make this problematic. And so that's one concern of ours. And then the other one, as I mentioned, is about employer and employee plans that are already utilizing these mechanisms. And so the pressure will be there. The last point is that U.S. Senator Bernie Sanders has had out there an amendment that he has filed but has not yet been accepted, but something that could come up. And again, with a willing administration, again, there's support from both current President Biden as well as previous President Trump for this idea. Would they open up the official foreign sellers list to beyond just drug establishment licensed wholesalers? So Bernie Sanders' proposal would open up who is qualified to export and would include pharmacies. So as we know, that falls under provincial jurisdiction. So these are all things to watch. Again, we just want to understand all the risks. And once you understand this through the lens of it being political, then you know we might be in for a roller coaster and we just need to be prepared. Thanks so much.
Wonderful, Danny. Thanks so much. All right, Jaclyn, happy to have you here today. Thanks for joining us.
Thank you so much, Ben. I appreciate your introduction. Sorry for the stressful last name that makes people panic.
That's okay. I hope to get it right.
It was pretty good. It was great. I just wanted to chat with everybody from the perspective of a small independent pharmacy and what maybe patients are worried about or what pharmacists are worried about, and really focus on explaining, I guess, what we see as a finite drug supply. And so the balance, like the previous speakers spoke about, is quite intricate and complex, and forecasting and all of those things that I don't understand creates for maybe a very stressful situation when we talk about bulk export. So pharmacies and pharmacists like myself, we really try to maintain the lowest inventory possible for many reasons, and it's quite an interesting thing. So for fast moving drugs that we have a lot of patients on, we try to keep like only a 10 to 15 day supply for our own patients. And if they're slower moving drugs, then we aim for like maybe a 5-day supply. And sometimes for drugs that we only have one patient on, then we're looking either to, depending on price, not carry any and order on demand because our shipments come daily and next day, or just have enough for 1 month. And in Saskatchewan, we only hold enough for 1 month. So to look at that, when patients are going on holidays and they ask us for 3 months, we actually require a lot of notice in Saskatchewan. And that leads into how wholesalers and manufacturers do their forecasting as well down the line. And it's drugs expire, like David mentioned, so we don't want to have a massive stockpile of medications, and that really doesn't exist. And when we talk about demand increasing, I'm just going to tell a little bit of a story. So in Canada, a small increase in demand can actually result in a shortage situation. And that's where it gets a little bit stressful for us when we're talking about the US asking for bulk export. So in 2022, in what we call the post-pandemic pandemic, we had quite an interesting situation where our cough and cold season started extremely early and was actually at an unprecedented level. We'd never seen anything like that. And it started in August, and by, I think, early October, we were out of Tylenol and Advil, and that also led into being shortages of amoxicillin for children. This is all child's medications. It was very stressful for patients, and the shortage situation then resulted in pharmacies being required to compound. And we were doing that and at a rate we've never seen before. I think we were filling about 100 calls a day to try to get prescriptions out to patients. And when that started to happen, we actually then saw a loss of ingredients and packaging, and those sort of things all started to go short too. And so this really does speak to the fact that small changes in demand can be really hard to recover from for manufacturers and wholesalers. I think at that time, manufacturers increased their production of Tylenol and Advil by like 13.9 million units, and we didn't see a resolution or stability of products until about March of 2023. And so that small shift in demand, even from our own country, was quickly depleting of the products that we had in stock. And that really could happen at any given time for multiple medications. And I think that's where what Danny said comes in, is if our patients see that there's a potential for the US to export drugs, we risk also patients panicking and coming for us and trying to build their own stockpiles, which generally doesn't work for insurance. And we try to calm people down and prevent that from happening. But it's an important point to be aware of when we start getting these questions from patients as well. So like Danny and the other speaker, David, alluded to, the sheer size of the US and how we currently manage our drug supply in Canada, they don't really mix well. There doesn't seem to be a very high chance of bulk exportation unless it's planned for. And that does create a whole host of other problems as well. So it's really quite a tricky, complex topic. And like Danny said, a very political situation. So hopefully that helps understand from the pharmacy side where we need to go for chatting with our patients and preventing some panic.
Wonderful. Thanks so much, Jaclyn. That was wonderful. All right, and last but not least, Ted. And I was remiss to say that you're also a industry veteran as well, even though you're on the professor side of the work these days. But great to have you, Ted.
Yeah, thank you very much, Ben. I do appreciate being invited, and also thanks to Mitch. It's really an honor to be on a panel and with such diverse points of view that David, Danny, and Jaclyn presented, and you know, I agree with all of them, and I think you know, not much to add in specifics other than maybe give some overarching commentary here. You know, I've been in the innovative you know, pharmaceutical business for decades, developing drugs, serving as CEO both in Europe, whereas, you know, we have some issues with parallel trade and also here in Canada. But, you know, in my current hat, I'm most concerned about public health, and that really gets to the issue of ensuring access, which all of my panelists have talked about, you know, the potential issues that we can face. Now, you know, the title of this symposium actually struck me, where the words, you know, could and might are in the title. And of course, could and might, you know, we can put that into a lot of analogies. We might not think it could happen, but everyone is cautioning that something could happen. You know, I looked at this situation, you know, Danny mentioned the political nature and the and even the political theater around this topic. And I would use the analogy that Governor DeSantis was sort of in his Super Bowl, deep in his own territory, as we say in football. And this recent FDA, the FDA lifting the ban, if you will, to me was sort of like a first down. And so still deep in his own territory. And you say, well, could or would something happen? And I think we do have that potential risk. But, to really go down the field, I think the points that I would agree with mostly is really operationalize. Sorry, I had difficult with that. Is really going to be probably the most difficult aspect. And then we also look into this. We're not hearing a lot about the Inflation Reduction Act as a way to reduce drug prices for Americans, as opposed to, well, getting drug from Canada. And if we see the situation in Florida, the original intention of supply is for Medicaid and the prisoner population. So are those patients themselves actually going to be seeing differences in prices right off the bat? So I would say the ability to execute this. I mean, we have to get drugs into the warehouse with all those agreements of who they're allowed to sell to, and then looking at really what defines a touchdown here or a field goal. Is it Americans really saying that I have a reduction in my price, or is it the government saving money in situations like Medicaid and prison populations in those areas where those populations are not having access to private insurance? So could and might, yes, a long way to go, but we know what happens in football games.
Well said, Ted. It's you got a lot of great points here, and I think that's going to actually lead well into our panel discussion. So before we jump into the panel discussion, we're going to take a quick break just for some innovative spotlights. But what I would ask for the audience is there is a Q&A button down at the bottom, so feel free to throw in some questions for our panel, and we'll do our best to include them as we go along the way here. So we'll turn it back, and we'll catch you in a few minutes.
Digital platforms are now a big part of delivering meaningful experiences to clients, patients, and their families, and ultimately represent their relationship with an organization. Introducing Bayshore's Digital Experience Platform, DX, a platform that applies over 50 years of community healthcare experience, augmented through a design thinking approach to solving problems. It was, and will continue to be, co-designed with patients, their family members, and care providers. Powered by AWS and MuleSoft, the DX platform scales on the cloud, ensuring one's privacy and security, and provides one with access to their data anytime, anywhere, and on the go. DX platform is engineered to deliver an extensible architecture approach to plug and play with various digital health technologies and service ecosystem partners. DX platform will be Bayshore's digital launchpad to craft delightful digital experiences and build products that deliver a meaningful and ultra-connected care experience to your loved ones receiving care at the comfort of their own home.
The pharma industry is changing faster than ever before. Organizations are facing challenges in today's landscape that are putting their top line and bottom line at risk. With new customer engagement needs and technology evolving at the speed of light, the need for agility is more important than ever. With over 15 years of healthcare experience, Impress delivers a wide range of best-in-class services that are specifically tailored to ensure our partners can adapt and excel in a rapidly changing market. We are experts at exceeding sales objectives and providing our partners with a significant competitive advantage. Whether the need is agility and speed, maximizing top and bottom line, introducing new skill sets, or risk mitigation, Impress stands ready to help. We are Canada's next generation commercial partner, and we are ideally positioned to continue to help our partners thrive in the months and years to come. To learn more, visit www.impress.com.
Step into the world of TalkTalk Communications, where passion, expertise, and commitment to healthcare come together to create impactful, integrated solutions. At TalkTalk, we believe that healthcare is about providing earlier and better access to care by supporting healthcare professionals in making informed decisions and educating patients. As a certified woman-owned organization, we take pride in the diverse perspectives we bring to the table to help you grow your brand and achieve your healthcare communication goals. Our team of over 35 dedicated employees, including half a dozen pharmacists, has the deep and broad skills necessary to support you at your own pace, whether you're looking to reinforce your brand management activities or implement medical communication projects. And now, with our new office in Old Toronto, we're even closer to our clients. At TalkTalk, we love delivering impactful results. Our metrics-driven case studies and industry recognition demonstrate our commitment to quality and innovation. But it's not only about results. That's why we're proud to be a certified great place to work. Join our loyal customers, including small, medium, and large pharmaceutical companies, pharmacy chains and banners, and medical and patient associations whose operations grow alongside us. Let's talk.
All right, welcome back. All right, I'm going to invite the panel to join us. So if you could come on video and unmute as soon as you have a moment. And while the panel is doing that, just want to take a quick moment to plug our spring webinar. So keep an eye out for that as it comes up. We're going to be talking about patient choice. So another hot topic to be coming up on the NPC webinar series. All right, well, thanks for joining us today, and thanks for those opening comments, because you know what, this is something where there's been, I'll call it misunderstandings, misinformation from the standpoint of, you know, really understanding the topic because of its complexities. You know, nothing intended in terms of misinformation, but I think it's just the word gets out there and it's understood and what it means to people. And there's so many stakeholders involved in this. So it's great to have you on the panel today to talk about this. We've actually got a question already from the audience here. So we'll start off with that because this one's an interesting one to throw around the room. So the question is, should we see this announcement from Florida rather than a threat as a unique opportunity to rally Canadians around choices regarding the sovereignty over the supply of essential medications, as well as to consider favorable conditions for the quicker approval and reimbursement of the most promising innovative therapies? So is this really a well-timed moment for these considerations as a part of a broader dialogue? As we think about some of the bills that are being established both north and south of the border. So I'll maybe open it up with that question. It's a bit of a doozy, but you know what, David, I'll put it to you just to get some initial thoughts on what you think about how this topic spills into other topics.
It is an interesting point, and maybe one that we should consider. You know, when there's two questions in there, right? Is, can we use this for other purposes? Sure. Is it a rallying cry? Potentially. I think, what we've seen, in our industry is adamant about is making sure that we keep the awareness high that this is a potential risk. And we've heard from the other panelists very eloquently sort of describe how, we need to hold it in that place where it is a known risk, but put it in context where it's a very remote possibility at this point. So that's kind of the first part. The second part, I guess, is how do we use this as a rallying cry? Don't know. Maybe we could. I'd sure love to explore that. In terms of any real kind of automatic ties to the time that it takes to get access to medicines here in Canada, it's maybe not a direct causal kind of relationship, but at the same time, I think we're going to continue to keep on, in the pharmaceutical industry, innovative pharmaceutical industry will continue to keep pressure on all stakeholders, like governments, et cetera, to make sure that we're constantly bringing top of mind awareness about the importance of having early and I'll say timely access to innovative medicines in this country.
Yep. Fair enough, David. That's great. Danny, you talked a little bit about down the same vein, around we have to be respectful. There are politics involved in this as well, right? And I'd love to get your perspective just on, how far does that go? Is there just about making a point at some point, or what does this look like as we progress?
Well, yeah, and I wanted to just build upon in terms of the opportunity. I think it does allow us it does talk about there is an interdependent relationship between Canada and the United States when it comes to things like supply. So we are, when it comes to things like, let's say, just drug shortages, we are bringing products in from the United States to address drug shortages in Canada. We're very proud of products that are manufactured in Canada that are exported legitimately. So I think it allows us to talk about the Canada-US relationship when it comes to medicines, the good things and some of the concerns as well. There's a lot happening with Canada in terms of looking at drug shortages. So understanding how this fits into the broader mix is good. And the United States is dealing with drug shortages as well. And so it allows us to maybe think about, what policies we need to put into place to better equip our populations in that way. But in terms of politics, how far does it go? Well, we see how wild and crazy our politics are these days. So that's why I say you never know. Like we were surprised that the FDA would approve Florida's application. And I think that the reason why it was approved was because of politics, was because there was a governor who was running for president and there was some things going on there. And, it's no surprise Colorado also, this is like an up and coming Democrat governor. So I think how far it goes, I think we just have to be prepared for those scenarios. And I think that Canada has done a great job of thinking through those various different scenarios, understanding the interdependence of the Canada-US relationship as well. So not to maybe irritate the relationship, ensuring we have certain responses in place. But if things go off the rails because of politics, that we could take things a bit further.
Yeah, fair enough. Ted, thoughts on that to springboard?
No, I think, we would appreciate any time that we have a situation that it presents an opportunity in some way. So again, on the broad strokes, there are ways that we can actually get even Canada to increase their investment in innovation. So it is a great thought, and the devil is always in the details. But just the general comment to always take these situations to distill out and harvest an opportunity. It is probably there for sure.
Yeah, fair. And Jaclyn, as you're thinking about the pharmacy perspective and the pharmacist perspective, and as you mentioned, grappling with the swings that could present themselves, and the fact that there's some compounding that could exacerbate some of the experience you're having at pharmacy today. How do you look at this from that perspective in terms of is this something that we use as a rally cry, as it were, to really ground ourselves on an opportunity to have a broader conversation, or should we really just be focusing in on particular areas?
Yeah, like I think Danny mentioned, especially when we were chatting before the webinar, that we do need to keep in mind that we are a trade partner with the US. And so right now we have a drug we're importing from the US because of a massive shortage. It's just a single drug that we have no alternatives for. And they were helping us out of that trouble. But I think if we can help them with one specific medication or in shortage situations, that may present a large opportunity. I think the panic comes in when we talk about the word bulk and then mass exportation. That sounds harder to manage. So there is likely an opportunity there for the industry. I don't know exactly what that is, but I'm sure there is.
Yeah, fair enough. Wonderful. And actually, I'll come back to Jaclyn on the next question from the audience. So the question is, will the FDA announcement affect retail pharmacies and hospital pharmacies in Canada? And maybe I'll take that question and kind of break it up into two parts, because I know we're talking about the potential of and the might and coulds, as Ted was calling out in his opening remarks. But is there anything that you're having to manage currently in terms of, are people coming in the door and saying, I'm reading this in the paper, or like, what does this mean? Are you having to manage that type of conversation as a part of this overall situation?
I am not, but I think I'm far enough north that I'm not actually getting much cross-border questions because they won't drive this far. It's too cold. We're not a good place to visit. But when I was working in southern Alberta, when we were only an hour and a half from the border, we did often have US travelers coming through. They would need to get Canadian prescriptions, and we did get quite a lot more questions about, can they access their drugs from Canada on a full-time basis? It's not an easy thing unless we're talking about the online pharmacies. So the online pharmacies is kind of probably the biggest area that we need to watch for sure.
Yeah, fair enough. And Danny, you spoke a little bit to online pharmacy, right? In terms of the current state of that. And there's that kind of, not acceptance, but there's a willingness that we're seeing today to progress some of that. What are you seeing in terms of how that's going to look as we go forward in the context of some of the coverage around this topic?
Yeah, so one of the things that our colleagues in the US, ASOP Global, have done, they do an annual consumer survey. We do an annual consumer survey as well. And what they find in their surveys is that Americans might not read the fine print. They see, Florida import medicines from Canada, and they think, oh, I can order online. So that's one concern, is that might not realize that ordering online from Canada is actually not allowed under the FDA. It's just not necessarily enforced. We don't have officials on our end checking what's leaving, and then there's just so much volume coming in that it's not necessarily always checked in the United States. And then one of the challenges is the oversight gaps that exist in Canada. So you might have in Canada a legitimate brick and mortar pharmacy, but there might be an online operation that is not legitimate because they might facilitate the sale of Canadian medications to the US, but also from outside of Canada, which just go directly from a location overseas to the consumer there. So one of our, and it might, so if it's an online, even a site like a broker that isn't a pharmacy, it's literally like just an online site. It has an oversight gap because it's not a pharmacy, so it's not under the oversight of the province, and it's not a drug establishment license holder, not a wholesaler, so it doesn't have oversight from the federal government. So that's why these businesses can continue to operate, and our role really is to advocate for greater oversight in place. But in lieu of that, they continue to happen. That's why I said the temptation on the state side, because already U.S. employers already have contracts with these brokers, the temptation is to expand those contracts to ensure that they are delivering on their promise to ensure that Americans are accessing Canadian drugs.
Yeah, that's fair. That's fair. And Ted, does that turn into a policy issue here in Canada, and something that we need to progress in a different vein, or as we think about current infrastructure?
Yeah, I was thinking it more in terms of your question about how are we managing this, and what are the questions that come in, because yes, at the end, I think Danny highlighted a lot of the potential policies that can ensure safety, purity, and supply. But I was taking your question, thinking about it in terms of what are we telling people who feel that they're not going to be able to access their drug, and how do we manage that? And managing that in a very complex situation, you have to embrace the complexity, because there's no way to give a simple answer of what's going on. I mean, if you saw the recent articles about why are Canadian carrots $1 in Mississippi and $4 in Toronto, you get into it, you start to see there are things you've never considered in what's driving those types of prices. And I'm not trying to be in jest about carrots and drugs, but there are so many factors, and we have to keep the average consumer with information that is accurate, that is not alarming. And it's almost like these stories that are developing. You have what we do know and what we don't know, and I think what we don't know is a bit bigger than what we do know.
Fair enough. Yeah, no, this is a great point. Great point. Well, we're coming up with about 5 minutes until we close up. So what I'm going to do is at Pangea, we often ask people what keeps you up at night. So that's going to be the question I'm going to go around the panel for. I'll give you each an opportunity for that one. I'm going to start with David on that one. Oh, you're on mute, David. Sorry.
Thank you. Piggybacking on some of what was just said in the last few minutes from the panel, I think, one of the things that I feel good about where we're at federally. I think there's a number of steps that have been taken to ensure that the protection mechanisms are there. There's obligations and duties to the pharmaceutical manufacturers to report and to be mindful of the potential risk of shortages. And that's great. So that's why I say it puts the bulk importation thing, at least at a large scale, somewhat, I think it lessens the risk of that happening. Where I think we need to kind of go a little deeper, and this is probably more for Jaclyn and Danny, but is on the provincial side of things. What can we ask of and this is what does keep me up at night, is what can we ask of our pharmacy colleges? What steps can they take to mitigate against the risk of this? I'll call it leakages, but there's different gaps, as Danny points out. And I think this applies to prescribers as well. We need to hold folks that might hold licenses in Canada that sit in the US, so very legitimately prescribing, but if they're using it as a tool to kind of draw on supply here in Canada, I think those things need to be addressed. So that's what I would add.
Yeah, brilliant. Jaclyn, what's keeping you up at night on this topic?
Ooh, that's a tricky one. There's a lot of threats in the pharmacy industry right now. But I guess drug shortages keep us up on a daily basis. And so balancing this fine supply chain issue is something that just causes us a lot of anxiety as pharmacists on a day-to-day basis when we're ordering. And it does keep us up at night when we place an order and 40% of what we're ordering isn't coming. Those are algorithms that I don't understand and I'm not in charge of, so I don't have any control. But I would love to maybe learn more about it and how those policies are formed, and then I guess advocate for it at the regulatory level that you're talking about. I have a bunch of meetings with MLAs and colleges coming up, and those are really important topics to have with them because they don't appear to be regulated, and there are some missing gaps like Danny talked about.
Yeah, great points. Danny, what's keeping you up?
So two things. One is that we missed something, and there is a way that Canadian medications with the approved FDA plan with Florida that there's going to be some shipment that's going to go to Florida. It's going to be set up, and then it's going to create a shortage. So it's just hard to get ahead of it. It's going to actually, even though the drug is not on the shortage list now, it would actually create a shortage. So that was one thing that we missed, a potential loophole or something like that. And then the second one is other speakers talked about it, is that at the provincial level and the U.S. temptation to allow for drugs to come from Canada and to open up the eligible foreign sellers, even though the FDA wouldn't want to really to revise the FDA final rule and open that up, and then it creates a lot of complication because then it requires more provincial involvement, and it could get to be messy.
Yeah, fair. That's fair. And Ted, the final word.
Yeah, thank you, Ben. I think using my football analogy, with such a desire to get down the field, what would fear most is, policies that even unintentionally impact public health with access, which is the overarching concern that we all have.
Yeah, very good. And I see Mitch is back with the hook.
Well, to use the football analogy, bang, the game's over. We have a hard stop at noon, so unfortunately we have to wrap things up. Ben and panel, that was just a fantastic discussion. It's very true that this topic is smack in the middle of a bunch of other related areas. So we're going to continue that conversation. If anybody has any questions that didn't get answered today, just send them to health@chronicle.org, and we will continue the discussion both through the NPC podcast with Jim Shea, Mark McElwain, and me, and the NPC Health Biz Weekly, which is the e-newsletter we send out every week. Both are free. You can sign up at pharmacongress.info and check out the podcast. It's on iTunes, Spotify, pretty much everywhere. I'll invite you to come back in a couple of months, and We'll be back for the spring webinar of the NPC on Wednesday, May the 29th, on the theme of patient choice. So save the date, and we'll see you then. Want to acknowledge Joe and everyone at Pangea Consultants. Big thanks to our team at the NPC Institute and Chronicle Companies. Special thanks to our partners for today's session. They are known as the finest companies in the life sciences: Bayshore Specialty RX, Imprez, McKesson Canada, RX Help One, Talk Communications, Torrey's LLP, Chronicle Companies, and the Pangea Group. And that is a wrap. Thank you for spending some of your morning with us. We'll see you in the spring.
And thanks again to our panel.